I think my favourite recent skin cancer patient story is had this 35-year-old tradie who came in, and to build rapport with the patients, often you sort of say, oh, righto, so I don't see too many mid-30s blokes coming here voluntarily. What's brought you in? And they usually complain then about someone who loves them has forced them to come and get a skin check, and it was easier not to argue, is usually the phrasing of it, how the conversation goes. And I then outline, look, I usually start with the scalp just to start somewhere. Sit there in your undies, grab a seat, I'll start with your scalp. And I say, actually, mate, are you aware of this spot on your scalp? He's like, nah, it's sort of hiding under your hair here. Looks a bit odd. Did your wife get you to come in because of this one? He's like, no. Do you reckon it's something? I was like, well, look, it's not a mole, it's something. I think we should test it. And so I tested at the end of the consult, and we see each other every 6 months now, this chap and I, because it turned out that it was an invasive melanoma, and we did get it really early. He complains whenever he comes to see me that every time I come for my routine skin check now, Hamilton, my wife reminds me that I owe her a life debt. And he just shakes his head and he says, problem is it's true. And that's a nice story, because it reinforced the fact that you can't find your own skin cancers necessarily. We all live in Australia, which has the highest melanoma rate in the world. Not all melanomas need the sun to exist. And listen to your friends and family when they're trying to look out for you and they say, hey, go on, get a skin check. It'll make me feel better if you get a skin check. Because they might be right.